Hey everybody, this is Jude Sullivan with Don't Overpay. I'm here with my friend Casey Collins. And the reason I wanted to have Casey join me on a conversation today is he has an incredible health journey to share with all of you related to Lyme. He's a very tough and resilient person, and I think you'll get to see and hear and realize that during the course of our conversation. If you ever had a diagnosis of Lyme, I think you understand, what the ramifications are and what type of struggles you have both individually and then also from a system perspective as well. So I'm very grateful to you, Casey, for giving me your time and sharing your story with whoever hears it. So why don't we start maybe just prior to the quote-unquote diagnosis, or when you're starting to feel issues. What was your life like before that time, and were you engaged in taking care of your health? Was that important to you? What was that like? And then let's walk into the point where you're starting to experience symptoms and problems and ultimately a diagnosis, and then whatever happened after that point.
Sure. Well, my life prior to Lyme, I was really healthy, physically active, tried to eat pretty healthy, take care of myself. At the time I started to have issues with Lyme, it was right around my junior year of college at University of Wisconsin. And so I'd say it was more of a sort of a nagging progression downhill of sudden symptoms, unexplainable symptoms that really progressed over a long period of time. But really, to answer your question, was I never had any major health issues prior to Lyme disease.
And by most people's standards, you'd say that you were taking care of yourself to the degree a junior in college was at that time, maybe?
Yeah, I mean, I can't say that all of my decision making was extremely healthy, but
Right.
I took good care of myself, tried to run, exercise 4 or 5 times a week,
Yep.
tried to eat healthy.
Yep.
It's kind of that period where you're transitioning into adulthood.
Right.
So I'd say I was pretty healthy overall.
Right. So you're starting to have these symptoms and this slow progression, this slow burn. So were you seeing medical providers then to kind of help you flush this stuff out, or were you doing things on your own? How did that work for you?
Well, going back, I can actually kind of remember the first symptoms I had when I got sick. It was fall of, I guess it would have been 2002. And I had been hiking up in northern Wisconsin. And a couple weeks later, I felt like I just got hit by a bus. Extreme exhaustion, couldn't get out of bed,
Wow.
had a hard time getting to class. Immediately I thought there was something wrong. So I actually called up and made an appointment with a doctor, and of course they immediately screened for depression and thought it was a mental health issue. And so they began sort of treating me for that. But they kind of ignored all the physical symptoms and didn't really do a good job screening.
So in addition to the fatigue, what other physical symptoms were you experiencing? It seems kind of odd to jump into depression
Yeah.
from just having the inability to get up, so to speak.
It was, it started out like really extreme headaches, eye pain, and then just sort of low energy.
Did they have you fill out any type of a psychological profile?
Not really to my recollection.
Okay. So you're going down this path of depression treatment. How long did that last, would you say?
Oh boy, once you kind of get in the system for that, it went on for about 6 years, 5-6 years.
So you're a mental health patient for 6 years after you initially start to become aware of symptoms.
Sure. Oh yeah.
And so what else was happening during this 6-year time for you?
So there were thyroid issues. You know, they tested for an abnormal thyroid, started treating me for that. There were concurrent pain management issues. A lot of times Lyme patients have, you know, neuromuscular pain. Their joints swell up, severe muscle aches. There were a lot of sort of intermittent health problems in addition to, you know, low energy, fatigue. Let's see what else. Yeah, it was rheumatology, endocrinology, basically sending you to places where they were going to address symptoms, but they weren't really looking at the root cause of the disease.
So was your primary care provider who took you down the depression path still responsible for your overall care at this time then as well?
No, he really wasn't involved because it was outside the scope of general practice at that point.
So how were you accessing these other points for thyroid or muscle aches and pains and things like that?
It was really, I mean, I'd kind of give the meat grinder analogy, where you're kind of shifted from one provider to another, and there's no coherent communication between any of them. It's like, well, you need to go to the pain clinic, or you need to go to the rheumatologist, and it's this sort of endless cycle that somebody that has a disease like this goes through, where they simply get shuffled around, and you know, essentially it's very costly and ineffective for the system as a whole.
So you didn't have somebody, quote unquote, on the inside as an advocate then. They were just kind of shuffling you into different clinics for different assessments related to presentation of symptoms that you're experiencing.
Yeah, that's exactly right. I mean, with that sort of an illness, you really need to be an advocate for yourself. I think, unfortunately, for a lot of people, is they assume that the system is going to be an advocate for them. But you really, with this type of disease, you need to winnow and sift through the system to try to find the answers on your own.
And when did you come to that realization in your own journey?
You know, it took me about 7 years to actually get a diagnosis.
And how did that happen?
It was a lot of reading. It was a lot of research. You know, my mom suggested, you know, that I get screened for Lyme, and I started reading more about it. I was aware of the disease itself, but it was nothing that had ever been, you know, brought up or screened for it. And so when I did get tested, you know, the doctor sort of, he kind of poo-pooed it as if, you know, this is not what your issue is.
Okay, so who made the decision for you to get screened? Was that a decision that you made and you told them, I want to be screened for this? Or did somebody else say, we should screen you for this? So I think there's a big difference.
Yeah, I said, we need to screen for this.
And with your first offering of that, how long did it take to be screened?
It happened that day.
Okay. So then you got a diagnosis or results from that. How long did that take?
A couple days.
Okay. And at that point, it confirmed that there was Lyme present, but the doctor was still dismissing that as a possible root cause for all the malady that you're experiencing.
Yes.
Really? Okay.
Yeah, so there was an affirmative test, and the doctor at that point, he would not contact me on his own. He had his nurse do it. And they said, well, we're going to give you some antibiotics for a few weeks, and that was basically it.
So I know we're speculating here, and that may not be fair to the person, but why do you think that the care provider was not wanting to speak with you directly?
I think because a lot of times doctors are, they think they always have the right answers, and they're not willing to admit when they're wrong. And I think this was a classic case of that. The guy knew that he wasn't doing his job, and this was something that he should have been looking at.
So this is about 7 years after the initial onset of symptoms. So you have confirmation that Lyme is present. So you go through antibiotic treatment,
Mm-hmm.
and then what?